Hi, everybody. My name is Grace Riley, and I'm a licensed clinical social worker at KSB. So, given the time of the year, we thought it would be a really good idea to talk a little about seasonal affective disorder. So, what is it? Seasonal affective disorder, also known or shortened as SAD, is a type of depression that's related to changes in the seasons. SAD begins and ends about the same time every year. In most cases, seasonal affective disorder symptoms appear during the late fall and early winter and go away during the sunnier days of the spring and summer. Less commonly, people with the opposite pattern have symptoms that begin in the spring and summer. What causes seasonal affective disorder? So we have less sunlight, shorter days, less activity during the winter months, and which might lead to maybe even poorer nutrition. And the specific cause for seasonal affective disorder really remains unknown, but these are some factors that may come into play. Think about your biological clock. The reduced level of sunlight in the fall and winter may cause a winter onset seasonal affective disorder. The decrease in sunlight may disrupt your body's internal clock and leading to feelings of depression. Serotonin levels may drop during this time too. Reduced sunlight can cause a drop in serotonin that may trigger depression as well. Okay. So what are the risk factors? Who's more at risk than others? So adults, or as you increase with age, it's more of a risk for it to happen to you. It's pretty rare for people age 20 and below. Women are more often affected than men. The low vitamin D level. Some vitamin D is produced in the skin when it's exposed to sunlight. Vitamin D can help boost serotonin activity. Less sunlight and not getting enough vitamin D from foods and other sources may result in low levels in the body, which may result in lower energy levels as well. Family history is a risk as well. People with seasonal affective disorder may be more likely to have blood relatives with seasonal affective disorder or another form of depression. Already having a diagnosis of depression or even bipolar disorder, your symptoms may worsen during this time of year if you have those conditions. And then living far away from the equator, seasonal affective disorder appears to be more common among those who live far north or far south of the equator. And this may be due to the decrease of sunlight during the winter and longer days during the summer months. And what are the symptoms? What do we need to look out for? Feeling down most of the day, nearly every day, losing interest in doing things that you typically enjoy. If you're typically an outgoing social person, you may noticing yourself be a little bit more withdrawn, may experience some irritability, increased anxiety, experiencing carbohydrate cravings too, or overeating and weight gain, difficulty focusing or concentrating, feeling hopeless, worthless, or guilty, may even have thoughts of not wanting to live. If you or someone you know experiences these kind of thoughts, tell somebody or go to your local emergency department. Thankfully, there is treatment. Psychotherapy is the first one that we have here. During psychotherapy, working through your thoughts, your emotions, and your behaviors associated with seasonal affective disorder, developing skills to manage the symptoms. Medications is also an option. Reach out to your doctors to address your symptoms. They may even check your vitamin D level. And then light exposure. Take advantage of the sunny days. Bundle up, go on a walk, maybe even sit by a window with the sunlight beams in. If you notice that your nutrition, your diet has been the greatest, Focus on that, eating a balanced diet, choosing foods that provide needed nutrition for your body. Eating better makes you feel better. You can also reach out to a local dietitian. And lastly, increased exercise. Exercise is a natural antidepressant. Go for a brisk walk, join a gym, a fitness center, clean up around the house, do some yoga at home. Anything could be helpful. If you or somebody you know that has been experiencing symptoms of seasonal affective disorder, we encourage you to tell a friend, family member, or a medical or mental health professional. Thank you all for listening. If you have any questions, feel free to type it in the comment box, and have a great day.